I want to start with Eisenhower's farewell address. It's 15 minutes long. I'd encourage you to check it out for yourself. I watched it a couple days ago. Pretty interesting. He talked about the military-industrial complex, and here's just a little excerpt from it.
Now, this conjunction of an immense military establishment and a large arms industry is new in the American experience. The total influence, economic, political, even spiritual, is felt in every city, every state house, every office of the federal government. We recognize the imperative need for this development, yet we must not fail to comprehend its grave implications. Our toil, resources, and livelihood are all involved. So is the very structure of our society. In the councils of government, we must guard against the acquisition of unwarranted influence, whether sought or unsought, by the military-industrial complex. The potential for the disastrous rise of misplaced power exists and will persist. We must never let the weight of this combination endanger our liberties or democratic processes.
Now, the interesting thing here is that he talked about how up until then there had never been a defense industry. It always been you get a war, the Ford Motor Company could start retooling and make airplanes, or they could do whatever, and he said it's necessary, it's absolutely essential that we have this military industrial complex. And likewise, we need a medical industrial complex too, because there are some big things that need to be handled by large entities like that. But the problem is, he said, is unwarranted influence. Okay, it's the unwarranted influence, it's the domination of the medical industrial complex. And just to illustrate that,
CBS Health Watch sponsored by Pfizer. Anderson Cooper 360. Brought to you by Pfizer.
ABC News Nightline. Brought to you by Pfizer. Making a difference. Brought to you by Pfizer.
This could go on a long time, so we'll just go ahead and say, who can tell me who Charlie Munger, what does the name Charlie Munger mean to any of you? Okay, and who was he?
Well, Berkshire Hathaway.
Berkshire Hathaway. He was Warren Buffett's sidekick. He was known for his pithy sayings, and I'll zoom in here a little bit. This is a collection of some of his sayings where he said, "All I want to know is where I'm going to die, so I'll never go there." This is a tweet from the Founders podcast talking about incentives. Number one, everyone underestimates the power of incentives. Number two, never ever think about anything else before thinking about the power of incentives. Number three, the most important rule in management is get the incentives right. Okay? And the problem with the healthcare system is all our incentives are wrong. They're incentivizing more visits, more tests, more long-term medication, and no one makes any money by keeping you healthy, at least in the medical industrial complex. And the results kind of speak for themselves. So this is the map of the United States of the prevalence of obesity in 1990. As you'll see, there's no state with an obesity rate of more than 14%. A generation later, there is now no state with an obesity rate of less than 20%. So went from nobody more than 14% to nobody less than 20%. About from the time of Eisenhower's speech on his farewell address until 2015, we saw an increase of diabetes from less than 1% to 7.4%, so about an 8-fold increase in the prevalence of diabetes. This headline, U.S. life expectancy declining due to more deaths in middle age, that's a sign that, like, what's the healthcare system should be all about? It's about making people live longer and healthier, and it's failing at that. So when I retired, I took early retirement from Mayo Clinic, and this is my last day of work there on August 3rd, 2021. Part of the reason that I was able to do it is because I qualified for retiree health insurance, which made my wife Lisa feel much less anxious about this. So because I started before 2003, with my years of service, I qualified for a $1,000 a month subsidy. And so our coverage for Mayo Select, which was the second level plan, was $950 a month in 2021. And the next year was $1,050. And the next year $1,150. And this year scheduled to be $1,460. Do you guys notice a familiar trend that resonates with what your insurances may have been doing? Okay, so that made me say we're in the startup business, not making a lot of money, qualifying for tax credits in the MNsure exchanges. So I went online to look at MNsure to see what could we get a plan for. I looked for the cheapest plan we could get in Austin, Minnesota, which is where I live. This is the plan that we looked at. In Coon Rapids and Hastings, $1,186 a month. Now we have some people here from Hastings. Are you under the impression that your insurance is super great in Hastings, like in terms of the great value and it's cheap? Okay, does that feel cheap to you?
No.
Okay, so this is the price without tax credits, okay. If you go to Moorhead, $1,403. St. Cloud, $1,445. Duluth, $1,493. For this very same plan, $7,500 deductible for 2 people, 2 adults age 61 now, because I just redid this again this last week to get these numbers. Austin, Albert Lee, Winona, Owatonna, Rochester. Now, if you live in Mankato, it's not right here in the I don't know, belly of the beast, not exactly. It's not right here in the, okay. It is $1,933, which kind of reminds me of this scene from Oh Brother, Where Art Thou? You guys familiar with the movie? Okay.
I had 2 weeks left on my sentence.
I couldn't wait 2 weeks. She'd get married tomorrow.
My added time for the escape. I don't get out now to 1987.
No, I am sorry about that.
I'll be 84 years old.
I guess they'll tack on 50 years for me, too.
Boys, we was chained together. I had to tell you something. Busting out alone was not an option. Sorry.
84 years old.
Well, I'll only be 82.
So Mankato's kind of the Del Mar, okay? I'll only be 82, okay? So this is what it looks like when you compare them all. And Hastings cost us $14,000 a year, okay? In our part of the state, it's $10,000 a year more. 73% surcharge premium for this. So the good news is this is before the Affordable Care Act tax credits. The bad news is guess who pays for the tax credits?